Honestly, I think it's using the questionnaires and taking a broader approach and moving into a facilitation mindset versus a fixing mindset that really helps us not to take it personally. And, I'm okay with saying to a patient at this point, this is what I do. This is what I have to offer. I really think I can help you, but maybe you're not at the right sort of stage of readiness to do this piece, and I leave my door open. So it really is about that sort of honest communication. And one questionnaire we haven't talked about, which I do use all the time, more on a one-off basis, and sometimes I think I should use it with everybody, but it's the PSOCQ, which is the Pain Stages of Change questionnaire. And if they're pre-contemplative, you're going to spin your wheels, and they may not be in a place where they're ready to really sort of work with you, and that's not personal, right? That is not, and we all have it. So that's my 2 cents worth.
Can I jump in on what you just said, because it's leading on from that? Laura Rathbone Van Meurs talks a lot about this, and that how you ground yourself as a physio is really important, or a therapist, or whatever you're doing. It isn't our job to go in and get someone better. It really isn't. It's our job to use all the knowledge that we've got to encourage someone to do something that then might make them feel better. But we're not in that body. At the end of the day, it obviously matters to us because we're all in this position because we care. But it really doesn't, what happens if they don't get better? Nothing to us. It is about them doing it for themselves and you becoming a good coach and collaborator. So the minute that you take the stress off yourself of going into every interaction with the intention of healing someone, that's not what you're there to do. You're there to bring them to where they need to get to for the healing by suggesting stuff. And we all know that because we've all tried to treat our family and failed. No one in my family listens to me, and I've certainly had loads of patients, not loads, but we have patients that just don't get on with it, but I've had them come back 2 years later, like Carolyn said, and say, I didn't want to, wasn't ready for it, especially in pelvic health where it's a bit more intimate. Take the pressure off. It's not your job to heal.
I think it's staying with someone on their journey and making sure that door is always open. Often, if they're not getting better, it's actually being able to seek other help. I mean, definitely I'm not in the, I'm more pelvic health, so I may be asking musculoskeletal colleagues, but very often helping people to realize they have a journey to heal themselves through seeing a psychologist, maybe a sexual counselor, or someone alongside. But I'm always here, ready to walk your journey with you. And they're not broken, so they don't need fixing. They need support. They need a listening ear. They need someone to not judge them and be with them. But often they need self-compassion. The person that's having struggle healing sometimes is having a struggle with themselves too, and needs help with that on their journey. And I think we're very privileged to help people. I love doing it every day, and I say I'm here for you. And to walk with you. I can give you different suggestions. It may not be the time for you. You're sounding like you're really busy. Do you want to give this a break and come back when you're in a better space? And we'll explore other options. I'm always here. I don't have the answer, but I always have a listening ear, and might know people that could help you. So it's I think it's walking with people.
I would just really agree with all that. That's very much how I practice, is more from a health coaching perspective. And again, that actually works well when we're doing our virtual care, and it almost allows you to embrace that even more, as Carolyn said. One thing I got thinking about, though, was the operational way that some of our practices are set up. And, this was alluded to already by Carolyn, sometimes is a bit of a barrier. Like some practices are set up where there's an expectation that you have a course of treatment and then a formal discharge. Mm-hmm. And you can hear, as we've all been talking, that isn't really the way that health is created. So that really doesn't lend itself, like that structure doesn't lend itself to our evolved understanding of how health works, how pain works. So I think we really need to sometimes look at how our practices are structured, even from that perspective, because that won't help us to enact this if we're still trying to impose those things.
And hanging on to patients is part of that, Sinead, isn't it? So when I think someone told me a while ago that when a patient was moved and asked to see someone else, and I felt quite hurt as a junior, thinking, what have I done wrong? I did everything I could to help that person. And my mentor at the time said, you probably did everything fine, but it's you. They don't like you, and that's okay. And again, Laura Rathbone van Meurs talks about this, that no, everyone's not going to like you. 5 to 20% of all people won't like you, and that's fine. If you think about how many people are online talking about our area or physio, and there is a voice for everyone, and it's okay not to be everyone's voice. And so I have a male pelvic health PT. I'm lucky to have one near me. So my male patients, automatically at sign up, I say, you can come and see me, but if you prefer to see a male, then go see Pete. And we have a team working situation so that you can pass people around, exactly, Sinead, like you're saying. But I'm in private practice where I have that option to be much more flexible. And like Carolyn was saying, with that kind of really slowly weaning off your patients, the supporting them
to the end.
Yeah.
But there is never an end, because pain flares up and you need to be there and help people understand and unpack that and understand why maybe things aren't going so well for them at this time. So yeah, I think it's that support and coaching. We've gone much more from I can treat you, is actually I'm here to facilitate your wellness journey.
And that comes back to this inherent belief that we all need to maybe rejig in our own minds that people aren't broken, that when they have pain, it's this language we've developed in physiotherapy around even dysfunction, right? What does that mean, right? And we pathologize tissue dysfunction, and I think that's a big shift that we all need to make, and that's going to be a tough one to turn around that boat, but I think it's coming. We're doing it. So